Ready to light up your life without the smoke? Say goodbye to cigarettes with Freedom Laser.
Next Pitch TV showcases the most innovative equity crowdfunding campaigns for the verdict of the crowd.
Behind this groundbreaking technology is Craig Nabat, a visionary determined to help people lead healthier, smoke-free lives. With Freedom Laser, he's making the impossible possible and transforming the future of smoking cessation.
And a very good morning, Craig. Nice to meet you, and welcome to Next Pitch TV, where we showcase the most innovative equity crowdfunding campaigns for the verdict of the crowd. Now, yours is really a particularly interesting campaign in my mind, especially because I am, like you, an ex-smoker. And so I was really intrigued to read about you, or to learn, I should say, about your solution. But let me allow you to please go ahead and explain to our audience what exactly you did and how it is coming along.
Okay. First, I want to thank you for having me on, and thank you for the opportunity. And I want to applaud you for this idea for Next Pitch. I think it's going to really be huge. So,
thank you.
Well done. Well, how did this start? I'm a former smoker. I grew up like many people, not liking cigarettes, and was stupid enough to pick them up at the age of 19 when I was away at college. Buddy of mine left a pack of cigarettes. My first 2 weeks of college at Arizona State, I pick up with a pack of cigarettes, go out on the motor scooter, go out in the mountains. I feel this new sense of freedom. And next thing I know, I'm addicted to cigarettes within 2 weeks. So I dabbled with smoking on and off for about 4 years and struggled to quit. Finally, I quit cold turkey, quit for 7 years. And then when I went back to smoking, I was so addicted. And I was trying everything to quit. I tried the patch, the gum, even lozenges, nothing's working at that point. So I was living in Detroit, Michigan at the time. And I heard about this laser treatment, low-level laser treatment that's based on the principles of acupuncture. And it helps to alleviate the physical withdrawal symptoms. I said, everything else is failing. And I was literally getting ulcers from smoking. I was chain smoking so much. So I said, I'll give it a try. I walked in this clinic in Canada. After one 30-minute treatment, I was free from nicotine. I was like, this is amazing. So I started bringing a woman I was dating at the time, brought my mother, my best friend, all these people I was bringing back into this clinic, and everyone was getting off smoking. And so the guy who was doing the practitioner at that time was doing treatments for about 19 years. He was a drug counselor. He was treating people with for heroin addiction, cocaine addiction, opioid addiction, and he was very successful at it. And he was licensing the technology around the world. And so laser therapy has been around, now it's been around over 50 years. Just in the United States, there was no FDA clearance, is why a lot of people have never heard of it. Now, there's laser therapy for other modalities. For growing hair is a really popular thing right now. But long story short, after I got off smoking, I'm a marketing guy by trade, and the person who went into the clinic said, you got to talk to this guy. You could blow up your clinic. So I ended up getting the clinic, and the Canadian clinic, on television, maybe like 6 TV stories within a week. He's like, we got to work together. So I worked with them for about 6 or 7 months. And I said, I'm moving to LA. I'm going to put up my own quit smoking laser therapy clinic. And we ended up, we're still good friends today, but we ended up not working together. And I established my own clinic. We had about 10,000 people that have been through a clinic treatment. So I've been doing this for 21 years, and I got so passionate about doing this because it worked for me so effortlessly. I was like, I got to help other people get off smoking. So the next evolution is you can only treat so many people. We're based in Los Angeles, and I understand that you had an office in Santa Monica for a while. That's where we originally put up our first office, which is inside Los Angeles, but so I basically was thinking, how do I expand this? How do I treat people outside? And people fly in. I mean, I had someone fly in from San Francisco a week ago to get treated. And it's, how do you treat people? Either I open up clinics nationwide or create a wearable device. So we worked on a device over about 20 years, many different prototypes and molds that we went through our own clinical studies with the wearable device, that basically you wear it 2 times a day for 15-minute treatments. And we're using the low-level laser technology to stimulate acupuncture points in the ears, and there's tranquil music that helps relax the mind and body. So in my clinic, I can get somebody off one 30-minute session, but the FDA would rather see a longer protocol like they had for the patch or the gum. People were on those products sometimes six months to a year, at least a year follow-up. So we're going to do a 30-day trial. And that's the whole purpose of the equity crowdfunding campaign, is to raise some funding to conduct the studies.
Wow. I mean, that is delightful. I love what you're doing and how you're doing it, quite frankly. And I happen to be very passionate about equity crowdfunding. Otherwise, I wouldn't be doing this. So what is it that led you to decide to take that particular path as opposed to conventional VC money, that sort of thing? Why this direction?
Because we needed the FDA approval, and a lot of the VCs want to see revenue. And I've already proven my technology. We did an animal study with mice. Then we moved forward and we did an IRB-approved pilot study with 28 subjects, and we know the technology works. We went into production for a short run of products, and all the people within the study were significantly reducing their desire for smoking. And we learned from the study, they wanted to use it more than once a day. They want to use it twice a day. So we increased the power of the laser based on the pilot study, and we're going to have it more twice a day instead of once a day thereafter. But back to your question about equity crowdfunding. It is a way to, one, bring in strategic partnerships, which a lot of people don't think in terms of that. Like, we're meeting today through equity crowdfunding. Where is this video going to go? Who we'll get to accredited investors as well as non-accredited investors, and right. So people, in my case, people that are passionate may have lost a loved one to smoking. You're a former smoker. You don't want to see other people addicted. I'm sure if you could go back in time, would you have ever smoked?
Yeah, for sure. I mean, it's interesting. My story is not all that dissimilar from yours in the sense that I, after college, went to Japan. And the people that I stayed with were chain smokers. And rather foolishly, I thought, if you can't beat them, join them. And, I can quit any time. Right. So, eventually it happened. Now, it's interesting. In my case, arguably, it's a somewhat different way in that I moved to the Philippines recently to a city called BGC. And what is important is that BGC, at the time, unbeknownst to me, is a no-smoking city.
Oh, wow.
What? No smoking city? It's one thing to discourage smoking. It's quite another to be in a no-smoking city. And it's kind of like, damn, that's a...
How long has it been like that? How long has it been like that?
For a number of years. I don't know specifically when they brought it in, but it is actually not all that unusual, apparently, in the Philippines. Davao was a city that was where the mayor ultimately became the president of the Philippines. And that was back in 2013 or something that they became one of the first no-smoking cities. So quite fascinating. But in any case, the point is that that, of course, was a rather different way, should we say, to quit smoking. It's simply not available,
it's non-invasive is the whole idea. Okay, right. So a lot of people here in the United States are thinking, when we first started the company, 43% of Americans were, 34.5% of Americans were smoking, and it keeps dropping. We're at like 28.5 now. And what's happening is now people are transitioning to vaping. So there's 11 million adults currently vaping. So a lot of people are thinking, well, smoking is on the downturn. 50% of my clients that are coming into my clinic are coming in for vaping. And what's happening, they're getting more addicted. The dependency is becoming stronger because they're doing it more often.
Right.
No, and now they have a new product. So the industry or the business isn't it isn't tobacco per se. It's nicotine.
Right.
So all these other products are the delivery device for the drug nicotine, and so that's our business model. And there's it's a $2 billion industry right now in the United States, getting people off smoking with the nicotine patches, the gum, the lozenges, and there's no FDA-approved method, drug-free, to help people get off nicotine. They're using... Go ahead.
I'm sorry, I didn't mean to cut you off there. In your case, you mentioned that you had an office clinic, well, whatever you want to call it, in LA, whether it's Santa Monica or wherever, it doesn't really matter.
One step over.
Oh, I see. Okay, to treat people and so on. Do you still have that? Is that
Yes.
okay?
Oh, yeah.
So that still continues to go on, but in the interim, you developed your new device. What intrigues me is, how did you actually do it? It's one thing to sort of say, hey, well, lasers one way to solve and so on. Quite another to actually go through the process, never mind the FDA approval, which is a nightmare in its own right.
It's a long story. Okay.
Yeah, exactly. But it's kind of, okay, well, can we find a way to do it yourself for the customers? Yes, apparently you can. Except that must have been, quite frankly, a major challenge to develop, not to mention that even once you have it, oh, yes, of course we can do it. You just need to order 10,000, or something.
All had to be made from scratch. Yeah. It had to be, I invented the product. I was involved with a China-based manufacturer for the past 27 years. That was my business partner. I was in the infomercial industry for a long time. And then when I got off smoking using laser, my business partner looks at me and goes, that's our new business. Let's go in that business. And so one, we put up the clinic, but then we went into developing a device. And we didn't know anything about the medical industry. So he had to learn how to become a medical manufacturing company. So that took a long time. Then we had to perfect the device. We had to figure out how to get through the FDA. And so your next question is like, have you been through this before? I invented a wearable device that was FDA cleared it was a helmet to stimulate hair growth using low-level lasers. And this product, when I was president, inventor and founder of the company, when I was president, the company ended up going to 20 million in sales.
Whoa.
And it's the number one selling product in its category on Amazon. And we built a hair care line, shampoo line, serum, supplements. So that was the reoccurring revenue for the business. And that was to ensure people continue to grow hair, and they had the most optimal way to grow hair. So I'm going to do the same thing with a Freedom Laser, where we're going to help people get off smoking, but it's not just going to be like an addiction company. It's going to be health, beauty, and wellness. So I have strategic partnerships. One of my partners here in LA owns one of the top cosmetic factories, and we actually are launching an anti-aging line this week, strangely enough. But there's a lot of damage that's caused from smoking. So we're going to use a lot of the technologies that we already have and apply it for Freedom Laser to help people repair the damage that's done from smoking.
There is a
So it's a health wellness company.
Sorry about that. There's a campaign that's currently live called Sensate that you may have heard of. It's a fantastic product. I'll let you look into it. The point that I'm trying to get at is, because they're doing equity crowdfunding as well, there might actually be a certain level of, I don't know what the right word is. Synergy. Well done. Yes, exactly. So you might want to look into that, simply because you can imagine if you're going to sit there for 15 minutes with your headphone anyway, and you have a Sensate stone in addition to that, one hand might be washing the other. In other words, you get 2 for 1. It's just a thought.
Okay, I'll look into it. Another aspect of what we're doing, so when someone comes into a clinical setting, they're watching a video dealing with the psychological aspects of overcoming the addiction. So it's not just laser to help with the withdrawal symptoms. I think 75% of quitting smoking or vaping having to do with breaking the psychological aspects of the addiction. So that's also, there's going to be a downloadable, it's what we're doing in the clinic. For the home use device, people are going to be able to have a program dealing with the psychological aspects of the addiction. There'll be a homeopathic oral spray they can use to help reduce the cravings. There'll be supplements as well. So it's just not just one and done. It's a whole program to keep them to stop smoking for life.
Wow, I love it. I mean, this is just absolutely great. To my mind, this is what entrepreneurship is all about. And it definitely ties into very nicely what equity crowdfunding, I think, is all about. Because as you point out, the name of the game is to say, I'd rather have hopefully thousands of investors at $100, $200, $500 a pop, rather than a couple of VCs with unreasonable terms typically. The point is that your supporters, I'm talking about the equity crowdfunding supporters, a good number of them are likely to actually be customers. That's just a bonus. Never mind the fact that they are likely to also become ambassadors for the brand, especially if they've used it and found it to be working. It doesn't get any better.
I mean, I'll tell you how strange this is. So we have the crowdfunding going, and I have a clinic. And then 3 weeks ago, I treated an anesthesiologist and a pain management doctor who's very successful. And it comes in, he's like, I've never heard of this technology. It was a referral. Because I've never heard of this technology. He got all excited after he was treated. He's like, this could work for anxiety and depression. I said, we're going to do clinical studies for that as well. He's like, well, I do clinical studies. And strangely enough, I actually lowered the amount of our raise substantially because I'm creating strategic partnerships, and getting organized, basically conducting the crowdfunding campaign and having them dial down and really understand the business model and putting it on a landing page and stuff. It's made it so much easier to communicate to other investors on top of the crowd, so to speak.
Right. I mean, one thing which has been amazing to me since we've tracked all these campaigns from the beginning, since I had one of the first campaigns on the first day that went live, is the success rate, meaning the rate at which campaigns at least reach their minimum target. Now, obviously, if you're trying to raise $1 million and you end up, let's say, with 50,000, just to take a number, and 50,000 happens to be a thing, so you've succeeded, you might say, oh, well, gee, what do you mean? You didn't raise $1 million, so you failed. Well, that's one way of looking at it. Statistically, however, you have at least succeeded in reaching the minimum, even if that's not the maximum that's out there. That success rate is 71%. It's kind of be kidding me. If you look at regular crowdfunding, I don't know the actual numbers, but it's probably in the neighborhood of 15 to 20% if you're lucky. So it's kind of like, why is this? And my guess is that the amount of preparation that it takes to do an equity crowdfunding campaign, starting with having a legal entity, i.e. business, as opposed to, oh yeah, I just woke up and had this great idea and so forth, doing videos, preparing the campaign itself, and all of that involved means there's a lot more attention to detail that apparently pays off. So it's great to see.
It's even creating your video, your pitch, your messaging. There is so much work, the legal aspects that go into it. Oh, yeah. And once you have a crowd, you can't think that you're going to put something on the crowdfunding campaign and it's going to explode. You have to put marketing dollars yourself behind it to get the exposure. You have to do things like what we're doing today. You have to go on podcasts. You have to promote either through Facebook or social media sites. You got to go back to your customers and appeal to them, say, would you like to be an investor? In our case, people that are been through our treatment and stuff. I've been reluctant actually to do that. Yeah, to go to the actual my former customers. And now we're not raising the same type. We were going to raise 1.2 million originally, so we're going for 275,000 now, which is doable.
Oh yeah, absolutely. Especially when you have something that works, which by the sounds of it, yours does. And, that's the way to go. So I'm absolutely thrilled with this. I really wish you the very best of luck. We'll go ahead and get this published as soon as possible. And hopefully it'll drive a lot of traffic to your campaign, which is what this is ultimately all about.
Thanks again. We're on Net Capital. It's netcapital/Freedom Laser.
Excellent. Thank you for pointing that out. I'm always bad when it comes to these kinds of things.
All good. Thank you very much. And best of luck to you. I think it's terrific what you're doing.
Thank you so much.
Join the nicotine-free revolution with Freedom Laser and founder Craig Nabat. Invest today in the only home-use quit-smoking laser device and be part of the movement that's helping people break free from smoking for good. To know more about the featured campaign, subscribe now to nextpitch.tv.